Good afternoon, everybody. I'm pleased to have been invited to talk about this important topic. So I'm going to focus most of my remarks on implementation in schools, which is where I have done most of my research, but as Denise referred to, I think that many of the examples from schools are generalized to other kinds of settings in which programs might be implemented. Whoops, I just pushed the wrong button. Other way. Okay, so I'm going to begin with the context to talk a little bit about what has been referred to as the life cycle of an intervention or of research about an intervention. So we have spent a lot of resources and emphasis on the left-hand side of this slide, studies that take a look at the efficacy and effectiveness of interventions. And the part of the research that we don't think about as much, or that is perhaps a little bit newer in the mix, is the idea of dissemination and implementation or translation of interventions to a broader scale. So within that area of research, we refer to factors related to pre-adoption, adoption or the intention to try an intervention, implementation, putting it into use, sustainability, using it over the longer term, and then going to scale on a broader basis. And the ultimate goal of our work, of course, is to have an impact on the population with these evidence-based interventions. So what has been accomplished? So we have an increased number of empirically validated prevention interventions, and we have strong evidence for the efficacy of many prevention interventions. We have somewhat less evidence for the effectiveness of them when they're implemented in real-world conditions. And in terms of disseminating information about this work, there are reviews of evidence-based programs available, and some of the literature reviews were referred to in several of the talks yesterday. And in many areas of prevention, including in violence prevention, we have some best practice guidelines that have been published that can provide guidance to communities about what the proven programs are. Yet we have this gap between the science of development and testing of interventions on the one side and the implementation or use of those interventions in real-world contexts. Many of us have heard about this gap. It is there, and we're still challenged with it. So how big is the gap? I was involved several years ago with a large national study of the use of evidence-based programs for substance abuse prevention in middle schools in the U.S., and this study was led by Chris Ringwald. What we did is we surveyed personnel in schools in 1999 and in 2005, and we asked schools about the kinds of programming they were doing on this topic. And as you can see here, a little bit less than 35% of the schools reported in 1999 they were using an evidence-based program. The prevalence went up somewhat in 2005, up to about 42%. But we expected to see somewhat greater of an increase, given that in 1999 there was a policy put into place called the Principles of Effectiveness that basically gave schools guidance that if they were applying for funds from the Safe and Drug-Free Schools pool of funds for substance use prevention programs, that they were to use proven programs. So those of you who work in schools don't need to really talk that much about or don't need to be educated about the challenges that we face in implementing prevention programs in schools. And many of these have been brought up so far in this context. We have schools focused on academic achievement, limited time and resources for prevention. We have a lot of school reform measures going on in schools, and we have things like tremendous staff turnover, somewhat limited capability to monitor implementation and collect outcome data. One of the challenges in terms of getting programs into place is that there's a complex decision-making process about which interventions will be implemented and how. There's stakeholders at many levels within, for example, in an average school organization. And in many cases, the tools that are out there that might be available for decision-making about prevention programs have limited distribution, or schools have limited access to them. We also see inequality in school resources and limited funding for sustained prevention efforts. So I and a number of other researchers across the country have taken a look at some of the factors that are associated with the adoption and use of evidence-based programs, prevention programs in schools. And in general, we place them into three categories: those that are related to the program itself, those related to the organization, and those related to the implementer or interventionist. So you can see here some of the things that are related to whether an intervention will be adopted and implemented, those that are more attractive and considered to be user-friendly, easy to use, flexibility of a model, using methods that are familiar to the school and the implementer, and a perceived advantage over what they're doing, and also those that fit well with the goals and practices of the organization are much more likely to be adopted and implemented. And then at the organizational level, there's many factors that have been associated with successful implementation: leadership, administrative support, someone in the school who is a champion for the program. There's been a lot of work on school climate, and so things such as morale and how happy people are in their jobs, that's related to uptake of programs. Organizational norms that suggest openness to change in new programs, and effective communication channels within the organization. And then at the implementer level, we have found across many studies that those who are more motivated, who have a positive attitude towards the program, are comfortable with the approach, have the skills with which to implement it, and have a strong sense of self-efficacy. Those are all associated with adoption and implementation of a new prevention program. So there are several frameworks that have been published that bring these categories of factors together. And the idea is that there are barriers and facilitators at multiple levels of influence. I've talked about the level of the implementer, the school, the community context is also important. And there are complex interactions between these levels of factors. And they influence whether implementation will be effective, as do what's referred to as the prevention delivery system and the prevention support system. So let me talk a little bit about what that means. So we also know in terms of support, we know that training is extremely important. And again, this has come up throughout this conference. The training of the implementers themselves, the training of other school personnel. For the person who's actually going to be implementing the program, training can produce or can result in greater self-efficacy and confidence, greater skill, can change motivation and attitudes towards the program. And there's a pretty strong database that shows that the training that is associated with stronger implementation fidelity and with outcomes. There's also some evidence to suggest that ongoing training, sometimes referred to as technical assistance, is important to increase implementation. So the delivery system is the organizational capacity. So obviously a school needs resources, funding, and appropriate staffing to take up a prevention program. And as I've mentioned, capacity involves managerial and administrative support. We also know in terms of delivery systems that effective partnerships with other kinds of organizations can increase the effectiveness of implementation. And Abby Fagan is going to talk about one such type of partnership or system. The other thing is that we know that when organizations have a data system that they develop and use for continuous quality improvement, that results in more effective implementation. So I've referred to effective implementation. What do we mean by that? In general, we mean implementation that is faithful to the program or the model as it was intended by the program developers. And there's a really strong push in general with implementation of evidence-based programs that they be done with fidelity. And fidelity is measured in a number of ways. We know from several studies in the school setting that the extent to which fidelity is there, there's a tremendous range when evidence-based programs are put into place in schools. Some schools have high fidelity, some quite a bit less. And teachers report in self-reports things like eliminating key modules in they're less likely to use some of the interactive methods that are key to the success of prevention programs, and they report generally deviating from the program as it's written. The other thing that we see is fairly common, and we saw this in the Ringwalt study, is that implementers will pull one part of an evidence-based program, one component from one component from another, and I think this was also mentioned yesterday as a common practice that we see. So why is there the emphasis on fidelity? We know, again, across many studies that it is important and it's associated with outcomes. This is a study that I did a number of years ago on a trial called the Adolescent Alcohol Prevention Trial, where we compared classrooms. We went out and observed implementation. We coded fidelity, and we see here that, at least in terms of immediate or short-term outcomes, they were higher among the higher fidelity classrooms relative to the lower fidelity classrooms. And again, there's a pretty strong evidence base for the importance of the relationship between fidelity and outcomes. Okay. So, however, a lot of people who are taking up evidence-based programs say, is strict adherence or is strict fidelity really feasible? And characteristically in this field, there's been a tension between fidelity and adaptation. We are learning in going out and observing what goes on with evidence-based programs in real-world settings that adaptation is common, and some have said ubiquitous. And so there might be reasons, intentional and unintentional, that people make adaptations. These are some of the reasons. Sometimes it has to do with making it a better fit for the culture of the students, to improve the cognitive information processing, and to improve their motivation, and just in general improve the fit between the program and the context. So we also know that more flexible programs are more likely to be implemented and sustained. But the problem is we know very little about what the effects of adaptation are on outcomes. And there's limited evidence to date that a great deal of adaptation can result in poorer outcomes. So there has been a movement towards more strategic or guided or planned adaptation. And so ideally this involves an interaction with the program developer. And there are some approaches that are being encouraged where a site will pick up an evidence-based program, and with the consultation, in consultation with the developer, based on the theory of the program, be able to change the intervention and adapt it for the context. So this is an effort here that has been promoted by the CDC for providing guidance to sites about adapting sexual risk reduction curricula. Okay, so I'm running out of time very quickly. How do we bridge this gap? So I have a few implications for practice. It appears that conducting an assessment of readiness is important in figuring out if your site is in shape to implement an evidence-based program. We've heard a lot at this conference about the importance of developing a broad base of supporters and involving a diverse group of stakeholders in the planning of a program. The program needs to be integrated with a school's primary mission of learning. And I think another important set of implications for practice are to develop systems for collecting data, to guide quality improvement, and better systems of data, of information about what's available locally. Finally, we have some challenges for researchers. We need to develop assessments of prevention program outcomes that can be utilized by schools as part of their accountability process, and evaluate the implementation of evidence-based programs under real-world conditions. We haven't done enough of these evaluations. We need to investigate how different models of training might be put into in place to improve implementation, do a better job of grounding programming in the realities of the school setting. We need to conduct more cost-benefit analyses. I've mentioned the research on adaptations. We need to investigate the effects of adaptations and conduct research on how evidence-based programs work in order to really understand the key ingredients of them. Thank you.